The top 5 reasons, from my experience, that you cannot get neutral in your PRI tests. First, you don't know what you're doing. Now, no offense, and I don't want to insult anybody, but to really understand this whole process, it takes a lot of time and a lot of study, and PRI therapists have to take seminar after seminar after seminar to really understand the big picture. It's very difficult for someone who's just watching the channel, my channel, or other channels and Instagram feeds that have PRI in them. It's very hard to piece all of that together. Almost nobody, pretty much nobody has ever come to me for help and clearly understood everything that's going on. Some people do actually have the big picture. They do get the big picture, but they can't understand how it all comes together. So again, I don't want to insult anybody's intelligence, but you just don't really know what you're doing. I didn't know what I was doing for the first 4 years that I was doing PRI. So again, don't take it personally. So you don't really know what you're doing. The techniques are difficult. No one comes to me and is doing the techniques the way I would actually teach them. It just doesn't happen. This is from almost 9 years of doing this, and 27, I think I'm up to 27 seminars. That's a lot of experience. There's no way you're going to do the techniques the same way that I would actually teach them. So the techniques are very, very difficult. If you think they're an exercise, like a gym exercise, you're doing the exact opposite of what they really are. They are not, and I've talked about that in a lot of different videos. Then what tests are you going by? Who's testing you? How do you know you're not neutral? How do you know you are neutral? You really don't. So on my channel, I have the adduction drop test. I have shoulder internal rotation. I have shoulder horizontal abduction. I think that's the only ones I really put up there. But the point is, are you being tested? Are you trying to test yourself, or are you having someone else test you? If you're having someone else test you, are they competent? Do they know what they're doing? There's a lot of people out there that take a couple seminars, maybe 1 or 2 seminars or 3, and they think they know what they're doing, but they really don't. So there's a lot of people who they're just not that experienced yet, so they might not be doing things correctly. So that would be, and also, especially on Instagram, there's a lot of people who talk about PRI who clearly understand nothing about PRI. That I can say confidently because I see it and it makes me want to throw up. I'm not going to lie. But you see it. Me, on the other hand, I waited at least 5 or 6 years before I started this channel, and I had already taken well over 15 courses before I even dared speak in public about this subject. Number 2, you have the wrong sneakers. If your sneakers do not have a solid heel, if you can squeeze back here and it can smush, it can crush, you can do this, or you can crush this shoe like this, it just balls up like that, they are not going to work for the vast majority of people. I have never seen anyone come in with minimalist shoes that could use those minimalist shoes to get neutral and stay neutral over a long period of time. It just doesn't happen. The reason is this. Someone who's in a pattern has lost ground sense. If someone's in a left AIC pattern, you know they have lost sense of the ground underneath, well, I don't have my right shoe, but the arch of the right foot and the heel of the left foot. That's what the definition of the pattern is. Someone who's over on the right leg, so this is my right side, the right foot does this, so they're generally sensing the outside of the right foot and the right heel area. So someone in a pattern, a left AIC pattern, is sensing the outside of the right foot and the heel too much. The left side is like this, so they're feeling more of the arch on the left side. So their feet are like this, right foot, left foot. That's the general pattern. There's a picture of it. That's the general pattern. You need to flip it. Left heel, arch of the right foot, and that transitions you over to the left side. If shoes do not have a solid heel and they do not have an insole, where is my insole? Here's my insole. If they don't have an insole with an arch, there's no guarantee that your brain will sense arch of the right foot, and heel of the left. And we're not talking about just the bottom of the heel. We're talking about around the edges of the heel. Right at the bottom of the foot, but around the edges of the bottom of the foot. That's where your brain needs to sense input, because most likely you have a foot that has an arch. If your foot has an arch, it was made for earth, for real ground. It was not made for flat floors that you probably live on. If you walk around barefoot outside, that's great, because the earth will fill the arch of your foot because the earth is uneven. Flat floors do not let your brain sense anything underneath the arch of your foot, especially if you're in this left AIC pattern, you're on the outside of that right foot. When you're walking with a shoe that has an arch, that more closely resembles real earth, real living conditions. People say, oh, but supportive shoes are unnatural. Well, you're already living in an unnatural environment. This is actually more natural. This thing and this is more natural for a foot that has an arch than walking barefoot on a flat floor. So now, can I walk barefoot at this point? Yeah, of course, because I'm no longer patterned. But someone who's in pain and is thus patterned and has lost sense of the ground, they need better sensory input from a shoe that their brain can then say, oh, my heel, there's the heel, let's turn on a hamstring. Oh, there's the arch, let's turn on a right glute. And if we feel those at the same time, right arch, left heel at the same time, this brain knows it's time to turn myself to the left. There's a left hamstring, there's a right glute, left inner thigh, left glute medius. Without those inputs, you won't get any of those muscles. So that would be the second reason why you may not be neutral, is because you simply still have an improper pair of shoes for you at this point in time. Maybe not in the future, but for right now, you got the wrong shoes. Reason number 3 would be loss of your normal cervical lordosis. So your neck should have a normal curve to it, just like your lower back should have a normal curve to it. In the lower back, usually it gets excessive. In the neck, it usually gets reduced. So when a normal lordosis, which this picture you can see, that's a normal lordosis, it has a curve to it. When someone loses that curve and their neck becomes straight or reversed, and that's what you see in this picture, that can happen for a lot of different reasons. And once that neck, that's also going to happen with a forward head posture. When that occurs, you know their neck muscles in the front, particularly the SCMs and the scalenes, and all these neck muscles here, all those neck muscles get overactive and tight and may not let go. And if you're trying to do a pelvis, if you're trying to get neutral in your pelvis and your rib cage, if your neck is in that position, straight, you'll notice it doesn't have a curve, but also notice the extreme curve in her lumbar spine. What's happening with this person is her pelvis is tilted forward. She has to lean backwards to stay upright, and then you'll see she's almost falling backwards, so then her neck comes forward. And so it's just, her body's just trying to straighten itself out. And that's going to, in an attempt to open up the airway, that's going to place the neck and really mandibular muscles also, the muscles on the side of your head, we often call them the right TMCC pattern. Those muscles will get overactive because the jaw will move backwards as the head comes forward. So in that position, you got a whole bunch of possibilities of why that neck got straight. But that neck being straight like that, will lead to hyperactive neck muscles and mandibular elevator muscles, temporalis, masseters. And in that position, you will not be able to get neutral in your pelvis and your rib cage, because these neck muscles, especially these SCMs, they will not turn off. They may not turn off from just the normal PRI techniques that you might find on my website, that you might find on the Postural Restoration website, and I've linked to a lot of them. You may need special techniques that will really seek to inhibit the neck musculature. The problem is they're really hard. There's no way, they're just hard. You need someone to work with on those. But again, you don't know that that's the case. You don't know that you have, just because you can't get neutral, it could be you don't know what you're doing and you don't know how to do the techniques and you don't know how to test yourself. number one. Number two, it could be the wrong sneakers. You can't just assume that it's your neck that's a problem. The other thing is this, sometimes necks are tight. Neck muscles can be tight and the testing will be limited, but when you lift their neck, it has a curve to it. So you know they're not in a forward head posture, their neck is just tight. And that's usually simply because they got the wrong shoes. They're not sensing the ground. And when they're not sensing the ground, that becomes a vestibular upright balance system and their neck tightens up as a protective mechanism. So I get a lot of necks to relax simply by just putting better shoes on somebody. So that would be my third. Loss of cervical lordosis due to something. Once that neck becomes overactive and you truly are in a forward head posture and the neck is straight, that may prevent you from getting neutral. To overcome that issue, you would really need to work with a PRI therapist in person who can assess what's going on. Number four, teeth, occlusion. So a couple things that can often lead to neck tension, jaw tension, again, which will often lead to a straight neck. This can all be included, is how your teeth are touching and the position of your jaw. Someone whose jaw is too far back will likely have a forward head posture. And now the neck is straight and you can't get neutral. Someone who has an open bite in the back, an open bite in the front, a cross bite, crowding sometimes, missing teeth, a missing molar, or missing molars, or people who've had numerous teeth pulled, particularly in the front or the molars, that can cause what we call malocclusion. Any of those situations can cause malocclusion. Not always. Well, the malocclusion is there, but you don't know how your brain's going to respond to it. You don't know how much tension is going to be created in the system. However, in any of those scenarios, it's possible that that malocclusion, having your teeth touching improperly or some other occlusal issue, could be holding your jaw muscles tight, and so head and jaw muscles tight and neck muscles tight, which then pulls your rib cage up, keeps you in spinal extension, and you can't get neutral. So teeth, malocclusion, teeth would be number four. And finally, number five is vision. Nothing will work. When it's something truly visual, like I had and what I've seen with some clients, you could try every technique in the book. Everything that I know how to do to get somebody neutral, even the proper shoes, will not change a thing. Vision will hold someone hostage. Some people don't know they need glasses, and that creates a lot of tension in their body, and they won't go neutral because they're not wearing their glasses, and their brain is saying, hey, I can't see, or this is too much strain, or my visual cortex all the way in the back of the brain is not being satisfied, so it just tightens you up as a protective mechanism and doesn't let you go, so you can't get neutral. Now, those people, if you put them in a 90-90 or any other type of technique, they're never going to feel the proper muscles. They just won't. They'll feel nothing. They'll feel their hip flexors, their quads, their back, their neck, but they don't feel what they should be feeling, and that's kind of how you know nothing's going to work. People who don't know they need glasses, some people have prescriptions that are too strong. They don't realize it. Sometimes they go to the optometrist and the optometrist says, hey, what's more clear? And they just saying, no, I like this because it's clear. It's more clear. It's more clear. But sometimes the more clear you get, the more hyper-focused you get, and you drop off your peripheral vision. So that's a known issue. And if you drop off your peripheral vision, your brain can't figure out where you are in space. So again, it holds you tight. So you don't want to be corrected past 20/20. A big difference between the two eyes. Some people have, one eye with a -2 and the other eye with a -4 or -5. I've seen that, and I could not get them neutral at all until one eye was closed. And when one eye closed, they would go neutral. But once both eyes were open, they would tighten up again. So that could be an issue, or also people with a binocular visual issue, which means their two eyes are not working as a team. And how do you know that might be happening? Well, again, they're not going to get neutral. They're not going to feel their muscles properly. And when you close one eye or patch it, their tests improve, or they can feel muscles that they couldn't feel before, and it can be instantaneous. So that's another thing. Anyone with a long history of visual issues, strabismus, like a lazy eye type of situation. Sometimes people have had some sort of refractive surgery, and it just doesn't work for them. And so for some people, it was not right. I made a video about this, why it might not be right for some people, but that could prevent people from getting neutral. So those would be the big 3 or 4 with the eyes. So that's my top 5 reasons why you may not get neutral. Start off with 1, 2, and 3. Those are the likely scenarios. Number 4, teeth, it's always possible, and eyes are less likely, but it does happen. So if you like this video, please share it, like it, subscribe, or comment. I'd